All right, so this is going to be a quick walkthrough on how to use the AI Medical Student web app. We'll use a fake patient example here. So we'll say we have a patient that is 56-year-old male coming in with chest pain. So a very classic example. So we'll type in the patient's age. If we wanted to change the sex, just click on male or female and they'll toggle. And then for chief complaint, let's say they came in with chest pain. So we'll search that up and add it in. Perfect. If you know any other additional symptoms that the patient endorses or denies, or you already asked the patient certain things, you can type that in here. So let's say the chest pain started less than 30 minutes ago. They've described the chest pain as a pressure. Chest pain, can't cite chest pain as a pressure. Let's say they're having some difficulty breathing. Okay, and we'll search that up. So even with some misspelling, the NLP backend will kind of process that through, and we'll still return back a list of symptoms. So we'll have chest pain lasting less than 30 minutes, so that's present. Chest pain, that's a pressure, and dyspnea or shortness of breath or difficulty breathing, so present. Perfect. So now we can see we have our chief complaint and our additional symptoms that have kind of populated into our patient note now. If you know any other additional risk factors at this point, you can add that in. So we'll click on the risk factors. We have a bunch of filters on the top. So common risk factors, cardiac, pulmonary. So for our patient, let's see, any cardiac risk factors. Let's give them high cholesterol. Let's say they have high blood pressure. Yeah, we'll do that for now. So you can see now risk factors are populated in, and if for whatever reason, if you made a mistake, you want to just delete it out, simply click on the risk factor or the additional symptoms. You'll see like a trash icon appear. So clicking on that will delete out a risk factor. And then if you know any labs for whatever reason, so let's say in our patient we have like a brain or BNP. If that's high, you can add that in here and they'll show up into our labs. But we're going to delete that out now just so we don't sway our differential too heavily. At this point, we can click on Suggest Symptoms or this little red flag icon, and they're both going to do something very similar. They're going to take all the information that we have in our patient note, send it off to the API backend, and return back a list of symptoms that we should ask the patient. The only difference is that the red flag symptoms are going to, sway more heavily towards urgent diagnoses. So you could think of this kind of as a triage tool. For now, we're just going to use our suggest symptoms. So does the patient endorse any fatigue? Let's say yes. Any palpitations? Sure. Fast heart rate? Any anxiety? No. No agoraphobia? Let's say no headache and no cough. Perfect. So now we have our updated patient note, and you can see now that we have added more to this note. We have the generate differential button available. So that's going to become available as long as you have a chief complaint, have the patient's age and sex, and you have at least 5 additional symptoms. So let's click on this now and we'll see, okay, this is our working differential. And you can see that the diagnoses are kind of ranged from most likely to least likely. It kind of ranges from 0 to 100%. And this is really based off of the Infermedica's AI backend. So we can see now for diagnoses that are more strong. So let's say MI is the most likely diagnosis at the current state. It's over 50%, so that's represented by this green progress bar. It also has this question mark icon. So if you toggle this, it'll show the supporting evidence or the conflicting evidence. So kind of describing what in your patient note or what symptoms the patient currently endorses that supports this diagnosis of MI or doesn't support this diagnosis of MI. Perfect. So also we have an additional questions card. So that kind of prompts you with a follow-up question for you to ask the patient. So have you been diagnosed with asthma? So let's say no. Perfect. And then we'll ask an additional question. Have you smoked? Let's say yes, smoking history. And you see now that we've added in smoking, that kind of sways the differential a little bit more. How long have you been experiencing shortness of breath? Less than an hour. That changes the differential again. And you can just keep doing this and it'll change the differential and really add to the patient interview. The question mark icon for additional question will just describe the rationale for the question. So when do you have trouble breathing? So as you see, if you click on the question mark icons, it says this question helps further characterize the dyspnea. This is further characterizing a symptom. All right, so that's the basic walkthrough of the AI Med Student app. This was designed more for, I guess, as a clinical training tool for early med students, so MS1s, MS2s, maybe even MS3s who are early on in their clinical rotations and still developing that clinical mindset. And it's really supposed to be kind of like a guide, so you can use it before the patient interview or even during. It'll help really guide the med students towards developing differential diagnoses, having follow-up questions to ask the patients, and yeah, that's pretty much it. So thanks for watching, and hope the app is useful.